Hello, today we welcome Dr. Baumann. He is Professor of Pediatric Gastroenterology and Hepatology at Hannover Medical School.
Welcome to Pediatric Hepatology at Hannover Medical School. I'm Ulrich Baumann and I will take you through daily life in our hospital during the days of the coronavirus. Hannover Medical School was founded in the late 60s as a standalone medical university. And at the time when people thought, how can we develop a distinct profile, it was felt transplantation would be the thing to do. So most of our departments, most of academic, scientific and clinical life in our center here is focused around solid organ transplantation. My group is specifically looking into gastroenterology and pediatric liver transplantation. The pediatric liver transplantation program has not been stopped. All liver transplantation program needs a team consensus, a group consensus that the transplant is urgent. And if it is urgent and all the group feels this is important to do and life-saving procedures, then we are allowed to do it.
All right.
And on the basis of that, we've done 2 and we'll probably do another transplant. We've done 2 in the last 2 weeks and we'll do another one now.
Okay. And the patient visits hasn't been postponed or?
No, the patient visit have been. We've stopped more or less the adult side. It's a big difference between adult practice and our pediatric practice. The adult practice has almost completely stopped. All elective patients have been discharged. In pediatrics, we were more flexible and we aim to cut back about 2/3 of the inpatients on the ward. And we've cut back about 3/4 of the outpatients, ambulatory patients. In practice, we had a lot of emergency referrals so that our liver ward was always full. Actually, we've been quite busy during those days with emergencies that couldn't go elsewhere, liver emergencies.
Okay.
So we were one of the few wards, even in the children's hospital, that had more or less normal work to do.
All right. Would you please share the procedures you had in place?
So we made a plan with all the transplant physicians and surgeons how to best cope with the situation, and it was felt that we should stop the life-related transplantation in adult kidney patients, and we all felt that a liver transplantation without the option for dialysis would be problematic to stop, and we thought it would be a good compromise to say we have weekly transplant conferences with all the adult and pediatric colleagues meeting one afternoon and to discuss the urgent patients in this forum. And if there was agreement that the individual case was urgent, then we could proceed. In practice, the adult program has almost stopped, also because there were no donations anymore. And my colleagues in surgery don't do life-related transplantation in adults here in our place. So it was, they've done a few adult patients, and in these recent weeks we did 2 pediatric life-related transplant procedures.
And living donor transplantation in pediatric patients stop as well, or because of the adult baby? No. Okay.
No, we didn't stop that. No, you were asking about the stepwise plan. So we did 3 steps. We decided to formalize it into 3 steps. And the first step was to discontinue this life-related kidney transplantation. The second step was to stop all elective cases in heart transplantation, lung transplantation, liver transplantation, kidney and pancreas transplantation, but all depending on the infection risk for the recipients. So all the patients were regularly screened for SARS-CoV-2. We also took into consideration the available capacity of the intensive care units, if there was capacity, and that was in close collaboration with we created a new, the German phrase would be Krankenhauseinsatzleitung. I'm trying to translate that. That's a mouthful even in German. It's a new, it's kind of these emergency doctors when there is a big accident, you know, you form a new head that is specifically looking into the emergency needs. Okay. So we have a new chairing department that works together with the kind of normal head of our hospital, and they integrate and lead the steps for medical care. And then finally, it was left to the transplant conference to decide on the individual case. So taking those 2 things into consideration, infection risk and intensive care capacity, and how life-threatening the condition of the patient was. And then the third step would be to discontinue all transplantation. We never had to go there, because in the north of Germany we had a lot less cases as compared to southern Germany, and there were even less cases in the former east of Germany. We feel that it's less to do with the protection and physical barriers and distancing, and more with less travel. Okay. In southern Germany, in Bavaria, the southern German regions, they just like to go skiing, and it's because of the close proximity. It's easier for them to go into the Alps for a day or so. And maybe that's a reason why we don't see quite as much. I mean, I like skiing, but we've just been fortunate that we had the skiing long before ISCO, before that happened. And maybe another reason why we're more fortunate here in the north of Germany is maybe we don't have that close physical contact anyway. You know, Germans are a bit boring. They don't hug each other as often as maybe we do in a little bit south of us here. So that's in layman terms, that's my explanation. Okay. We have we all regularly have these mouthpieces. I mean, the regular protection. There are always little signposts: stay away from 1.50 meters. And it has an impact on working together. My group, we are about 20 people, and it's quite hard. We work so closely together, and it's a multi-professional team. And I said, hey, how can we work together if we're not allowed to meet each other? And for a week or so, we tried to continue with our morning meeting. You know, 8 o'clock in the morning, we meet all together, talking about the day, what the person on call tells us what happened overnight, and what's the plan, who's doing endoscopy. And that informal, or that gives That formal meeting gives us a good opportunity to just touch base. Oh, you've recovered from illness, or I'm going on holiday, and just make sure this and that happens. And that's not possible these days. So it's a little bit of fun to meet on a screen. It's a new experience, but on the other hand, we realize what's missing. And to function, to fully function, you need to trust people. You need to know, did it go down well, what I just said, and did he understand? I'm asking him to do this and that, and is he doing it now? So that's the question. And then other formal meetings, we do our regular, we have a pathology meeting for the liver biopsies. We meet once a week or so. We have a radiology meeting, and to do these on the screen is just a bit more tedious, and it's doable. It's nice to see that it's doable, and it's nice to see that we can talk on the screen now, but it's nicer to have a coffee together and have a proper chat. So it's better than nothing, but we look forward to when we can meet in person again.
So I don't want to take more time. So thank you very much.
Thank you. Thank you, Marisa. It was a pleasure to talk to you.
Yes, and hope to see you soon.